Hello everyone, I am Kayla Linguaje and today I'll be performing Leopold'S maneuver return demonstration. So Leopold'S maneuver is used to systematically palpate curved uterus and it is an easy to perform non-invasive method to determine the position, presentation, and engagement of the fetus inside the uterus. So Leopold'S maneuver is done after 36 weeks of gestation to help the expectant mother and the healthcare provider to be better prepared for the labor, and also it helps in determining if it is much safer to perform cesarean section. So prior to the conduct of procedure, I have prepared the necessary equipments needed, which is the pillow, the towel, and the stethoscope. And also I have performed hand washing. This is to protect my patient and also myself as well from infection and cross-contamination. So hello ma'am, I am Bella Linguaje, your student nurse for today. May I see your wrist, please? Please state your name and your birthday, ma'am. Alright, so how would you like me to call you, ma'am? Alright, so ma'am, I'll be performing Leopold'S maneuver. This is an easy method to determine the position of your baby inside your uterus. Alright? Alright, so what I'm going to do is I'll be palpating your abdomen and apply a little pressure so that I can feel and determine the position of your baby, okay? Alright, so I'll just close the door so that later no one will be able to disturb us while doing the procedure. Okay? Alright, so now ma'am, before we begin with the procedure, I need you to void first so that later you won't feel uncomfortable. Okay? So, an empty bladder promotes comfort and it allows productive examination. Okay, so now ma'am that you're done voiding, I need you to lie down and slightly flex your knee and please turn to your side. I'll be placing this towel under your hip. Okay, so position the patient to a supine position with pillow under her head and a towel under her hip. This will displace the uterus of the inferior vena cava and thus the aorta, thus preventing supine hypotensive syndrome. Okay, so now ma'am, I'll be needing to expose your abdomen. So expose only the area of examination. So if you're right-handed, place on the right side of the patient and now face the patient. Alright, so now ma'am, I'll be proceeding to the first maneuver, which is called the fundal grip. So now I'll be palpating the uterine fundus. This is to determine which part of the body is at the upper part of the uterus. It may be the fetal head or breech. So fetal head feels round, hard, and removable, while breech feels softer and nodular. Alright, so now I'll be proceeding to the second maneuver, which is called the umbilical grip. So what I'm going to do is to palpate downwards on the lateral uterine surface and determine the fetal back or fetal extremities. Now apply a little pressure. Alright, and now I'll be proceeding to the third maneuver, which is called the Leopold'S grip. And to do that, I am going to place my hand over the symphysis pubis and grasp the lower uterine segment. This is to using the thumb and the fingers. This is to also to determine if the engagement has already occurred. Alright, so now I'm going to proceed with the fourth maneuver, which is called the Leopold'S grip. This is to determine the findings of the third maneuver as well as to determine the presenting part of the hypogastrium of the mother. And also it is done to determine the cephalic prominence. So if the prominence is at the same side as of the fetal extremities, then its head is flexed. And if the prominence is at the same side as of the fetal back, then it is extended. Alright, so now that we're done with the procedure, we're going to locate again the fetal back and listen for the fetal heart tone. Alright, so ma'am, after doing the procedure, I have determined that your baby is at your right side, and that is your baby is in cephalic position, which means the baby's head is on the lower part of your uterus, and it is already engaged. And this is the ideal position of the labor. And also, when I was listening to your baby's heartbeat, I have counted it and it is in 120 beats per minute. So that is normal. So do you have any questions or clarifications, ma'am? Alright, so I'll cover you up now. Alright, so after doing the procedure, make sure to perform hand washing and also proceed to documentation. Thank you.